Instead, we have the opportunity to make a habit of empathy, to recognize ourselves in each other.
Does anybody have anything written down yet? If so, you can bring it up. And those of you that haven't, we may have you make comments from your tables. Attention up here. And for those of you that haven't written something yet, you can finish up, and I may just let you speak from your table since we didn't get everybody's yet. So
basically, we were talking about how empathy is natural and it's a foundational value like how it can operate in healthcare is one expression, but it's a foundational value for all aspects of life, all aspects of our community. We spoke about how, particularly in healthcare, that empathy is natural when someone's in pain to feel for that person. So that it's really about just removing what's unnatural and sort of getting in the way of that empathy.
Well, we talked a lot about how empathy is a real building block for creating trust between people. And in the healthcare profession, there's so much distrust and so much perceived oppression and victimization, and that when the medical professionals as well as the patients can develop empathy and create a bigger understanding of what each other's dealing with, then healing can happen.
What were the barriers that prevented empathy between like doctor and patient, or and we basically decided it was that the whole system is unempathetic right now because it's overloaded, it's overstressed, everywhere from the receptionist to the doctors who are overloaded with cases, with paperwork. We're not sure how, but we just think the entire system, because of all the various stresses, is just basically unempathetic right now.
We had a very interesting discussion about empathy, and there, in some places, I don't think there was a complete general consensus, on every point. We did sort of reach a conclusion that in a bureaucracy or in a large system, healthcare, there may be sort of built-in obstacles to empathy, whether it's a single payer or whatever, just in the fact that a bureaucracy can be very impersonal. And we did also toss around the idea that a doctor, quote unquote, a doctor is a scientist, is somebody that has to have a very large amount of information about a lot of different medical issues, and sort of the nature of a doctor might make that person somewhat unempathetic, although it still depends on what individual we're talking about. And then there was the question of, is it really black and white? Is it a person is not empathetic completely and one is empathetic completely, or are there a lot of shades in between? And we kind of reached the conclusion that, especially with the insurance industry, where a lot of times you're talking to somebody on the telephone and that's it, there's almost no empathy whatsoever. And that's, one of the major problems in the system.
So what we talked about was having conscious choice with empathy, so that we're not approaching it with the feeling that it's a need so much, but it's an opportunity and invitation for us to enter into. And the other thing that we talked about was developing a more cooperative language or paradigm system, so that we're not fighting against or we're not speaking with the language of fighting against or working against each other, but working with each other. And that we can take into our healthcare practices in terms of working together with patient. So it's not patient versus physician, it's we're moving towards health for the patient together.
Well, you're just talking about systems, like where is there a lack of empathy? Is it the insurance company? Is it in the hospital? Is it the kind of care that we're providing? Is it the education that our physicians are receiving? Is it kind of, where do you can't really pin it down. It's the whole system.
Yeah, I brought up the example of, here we go again, Barack Obama's mother. I really like the woman. I really do, I'm sorry. I wish I could, she was here and alive, and because I think she was an extraordinary woman. But I thought about her as an example because I remember Barack Obama has said it more than one time. His mother was lying in the hospital for 3 weeks, arguing with her insurance carrier. And it was the insurance carrier that said that her condition was pre-existing, and so they could not treat her. And essentially, the insurance company, in my opinion, I'm sorry to be very cold about this because I have very little respect for the insurance company, they killed her. And I had a wake-up call at that moment, and I said, how many other people have been killed under the insurance company? Lack of empathy.
Right, right.
I mean, really?
In terms of from the video from Barack Obama, I thought it was important that what he was talking about was having the self-awareness to know our own beliefs, our own thoughts on things, so that we can be able to empathize and really understand our doubts, our fears, and by doing that, having that self-knowledge, we're able to understand the other. I think that's important in terms of in looking at healthcare, working with patients and having them become responsible for their own health, and then the healthcare provider can help them in their journey, and so it's not. So they're responsible.
They're always talking about, they have to have such high insurance because everybody here is ready to sue their doctor if they do something wrong. And what they've found is if they can actually spend more time with each patient and actually get to know the patient, and the patient feels like they're really caring and empathetic towards them as a person, nothing to do with the actual illness, but as a person, that people don't sue their doctors. It's when they're raced through, they felt like they're not being heard, they are not being viewed as a person, and that has a lot to do with why there's such this reaction, because people feel unheard and not listened to.
Just reorganize, I don't know, we need to start from scratch and figure out something. I don't know what, but we have to think about it. People are not getting the care that they should, and I think it's just a lot of politics. I think it's, one hand is in it. I used to do billing for insurance, and I see that, if a person, I have a friend who had kidney transplant, plus she had a heart attack, she had a heart transplant, and she has to be on medication for the rest of her life. And she told me the other day that the doctor just changed her medication. She went to go pick up medication from the pharmacy, and it was different medication, and they hadn't told her. And I said, it's probably because the pharmaceuticals have a new prescription or a new drug that they want her to be on, and the doctor gets a certain cut for him putting her on this versus keeping her on what she was on before. And she said when she changed, she's been on it a couple of days and she's having problems. But the doctor never mentioned to her about changing it and any side effects or anything with the medication. But I said it's just so much politics involved with it. And I don't know, this bothers me because so many people die from not getting treatment, and these are people that even have insurance.
Right,
so
right.
The people that don't have insurance,
Right.
That's a whole nother story.
This is what we have to remove from healthcare and hopefully replace with empathy. But there was a letter to the editor, and they were saying it's just like remodeling your kitchen. You've got to completely gut out the whole system.